Good evening, friends. We have heard of what is called as a manic episode. What do you mean by mania? The patients who are afflicted with this disorder, they are full of energy, full of enthusiasm. They talk with a lot of pressure. They have pressure of speech. They have flight of ideas. They keep on moving from one idea to another idea. There can be incoherence. There can be irrelevance. Such episodes of excessive energy, excessive talking, not only can occur in one of the psychiatric conditions, what's called as bipolar affective disorder, in which patients can move from either high energy to low energy, then low level to high levels of energy. Mood swings can occur. This is what's called as a manic episode. Apart from this psychiatric condition, are there any other triggers or precipitating factors or stimulants which can trigger off a person to develop high energy, to develop excessive talking, to develop lots of the pressures of speech, or trying to indulge in excessive social activities? One thing is, we have observed that there are some patients of depression who keep on consuming antidepressants on their own. They do not want to consult a psychiatrist. They go to the chemist shop, purchase medication from the chemist, known chemist. They keep on consuming antidepressants for months together, for years together. This should stop, because such consumption of medications, such consumption of antidepressants can trigger off a manic episode. Other thing is stimulants. Some stimulants like amphetamine, cocaine, etc. That also, if consumed inadvertently, can produce excessive energy, excessive pressure of speech. Some of the medications like pseudoephedrine, which we find in cold syrups, that can stimulate an episode of excessive talking. Theophylline, a drug which common physicians or general physicians or general practitioners use to treat bronchial asthma, that can trigger off an excessive energy in the person who takes it. Then some of the medications which we give for Parkinsonism, neurologists give, neurosurgeons give, psychiatrists give. What medications are these? Levodopa, carbidopa, then bromocriptine. Mark my words, my friends, these anti-Parkinsonian medications can also trigger off a manic episode and make the person excessively full of energy, full of enthusiasm. Steroids, inadvertent usage of corticosteroids can trigger off a manic episode. These are medications. You may be wondering, sir, does any drug withdrawal produce a manic episode? Yes, you are not wrong. Some medications, if withdrawn, they can trigger off a manic episode. Which drugs? First and foremost, alcohol. Alcohol withdrawal can produce a manic episode culminating in excessive outbursts of energy in the person afflicted. Benzodiazepine withdrawal. We find that many patients, even normal individuals who do not get sleep properly, in a bid to fall asleep, what do? They go to a chemist shop. Over the counter, unfortunately, some medications are available, like Librium, like Alprax, like Hypnotil, etc. These are all called as benzodiazepines. Withdrawal of benzodiazepines can trigger off a manic episode. It's high time that our high courts take cognizance of such medications being inadvertently consumed by the persons. It's alright, but let them take cognizance of the fact that it is the chemists who are not authorized to dispense the medications without an authorized prescription from a doctor, they keep on dispensing it. If some high court, a conscientious high court judge can take a suo motu cognizance of this catastrophe which is occurring in the society, the judge can prevent a lot of catastrophes. Purchasing medications without the prescription of a psychiatrist and the chemist dispensing it, that's all causing a lot of problems. Then after discontinuation of chronic treatment with chloride, that can trigger off a manic episode. There are certain other modalities which can produce an excessive energy and excessive talking, etc. in the individuals afflicted. What are those? One is light therapy. In countries abroad, in Western countries like England and all that, they do not have sunshine, they do not have bright sun throughout the year. During cloudy season, during rainy season, when there is no stimulation to the brain from light, from bright light, such people can skip into depression. This is depression which can occur because of deprivation from bright sources of light. What do psychiatrists do at that time? They artificially give light therapy, bright light therapy to such people who are immersed in their blues because of lack of stimulation of light from the sun. Such light therapy sometimes can not only undo the depression, but God forbid, sometimes it can make such individuals to slip into an excessive outburst of energy. It can make them to slip into a manic episode. The sleep deprivation. There are some people who want to deliberately, artificially, intentionally get their sleep deprived. Perhaps some postgraduate students who are preparing for the examinations, such individuals, when they are being subjected to sleep deprivation, it can cause a catastrophe called as a switch into a manic episode. By many, I mean excessive energy, excessive talking, excessive spending of money, then erratic indulgences in sexual affairs, etc. These are the common triggering factors, precipitating factors for such manic episodes. Hence, we doctors have to be doubly cautious about this catastrophe, and the lay public also. The persons who are not doctors, they also have to be aware of such a catastrophe occurring in the event of their resorting to taking medications over the counter. Thanks a lot for watching the video. Please share it amongst your friends. All the best. Thank you. God bless you.